Because the school board gets dinner when they have meetings, so I know we're not as important, but potluck. Yeah. All right, we're going to start right at 4:30. Okay. Real quick show of hands. Who here is a parent? Because we're also going to make sure we have. Oh, we got plenty. Okay, we're good. All right. Yeah. So we'll talk about the bylaws and stuff, but we have to have 51% of total membership, and then of the people that are here, 51% of those have to be parents. So we are good to go today. All right, it is 4:30. Are we recording? Good. All right, thank you. Let's go ahead and call the meeting to order. And start the clicker. All right, thanks for everyone for being here. Traffic was not bad at all, hopefully, for everybody. So for the agenda today, we're going to recap the last meeting. We do have 2 meetings of minute approvals that we need to have. I just realized that we didn't send y'all a copy of the minutes, so we'll quickly can kind of go through those. Generally, it's if you have access to the recording, it's a summary of what was said and done there. Since we didn't have a quorum last meeting, there were actually no decisions made, so that we can go through that pretty quick. Then we're going to have community feedback. We're going to go through the status items, and then we'll get things for next meeting. We will have action items for each subcommittee, so we'll go through each of those. So let's just start with the list. And so welcome, and obviously for the recap of the last meeting, I'm trying to remember, let's see, actually I would say we could pull it up, but I have it in front of me. And I do apologize for not sending everyone a copy of the minutes from last meeting. I'm sure everyone would have read them if I sent those. But let's see, I'm going to go through and hit the highlights here. So this was for the meeting in November. Again, we did not have quorum, so we did not make any decisions or take any actions. Each subcommittee provided an update. We also recapped the same thing we talk about with GroupMe chat, as in if it's available, and we'll mention that again as well. There was a little bit of community feedback that we discussed. Each subcommittee went through the action items that they had gone through with their meetings over the period between the September meeting and the November meeting. And we had a few action items at the closing around data collection. We didn't vote on that. Obviously, again, there was no quorum, but they're based on the understanding of the SHAC and the existing bylaws. We did talk about data collection, and that at the basically that the co-chairs would be able to submit to the board on behalf of SHAC for data requests, which we did, and we'll go through what was sent and what was received. All right. So basically what we are going to need is a motion to approve the minutes for each of these. And so can I get a motion to approve the minutes from September 23rd? Passion motion. Can I get a second? I'll give it Tricia. I'll get you next time. Tricia's second. Can I get a show of uplifted hands? All in favor? Okay. Anybody abstain or no to approve the minutes? No? All right. Can I also get a motion to approve the minutes from the November 11th meeting? Yeah, motion. Can I get a second? All right, second. Same thing, all in favor, show by the uplifted hand. All right, motion passes. And anybody abstain or a no vote on approving the minutes? Perfect, thank you. All right, Chris, do we have any feedback for the SHAC?
We had one inquiry, an individual emailed asking they were interested in becoming a teacher for the district and wanted to know if they're required to get the COVID vaccine or flu shot. And the answer from HR obviously was no. That was the only thing I received.
Okay. And so they submit that to the SHAC? Yeah? Okay. All right. Does anyone have comments about the COVID vaccine? We'll pass on that one. All right. Okay. All right, so we're going to go through the SHAC status. I think we have a few slides on these. So these are the communications that were sent. These slides are really just meant as a recap in case anybody missed anything. So at the top, so we did have a data request response from the district that we will talk about on December 20th. We did email meeting reminders. Hopefully everyone is getting these reminders. And there were chat activity on the GroupMe chat. Again, if you don't have it, there's the QR code that you can scan. For the data requests themselves, we did send a data request to the board on December 9th. I'm sorry, on December 2nd, and I followed up on December 9th because we didn't get a response. President Odenweller and Dr. Vincent followed up with us on the same day. Dr. Taylor, Tamika Taylor, took over and got all the responses back to us on December 15th, and then those were forwarded out to everyone here on December 20th. Okay. What else? Oh, I'm sorry. Dr. Taylor gave us to on the 17th, just to be clear. We did have some emails exchanged with Board Trustee Lindsay Dawson, and we will talk about that regarding screen time. Okay, does anybody have any questions or comments on our communication activity? Everybody's happy? Everybody got all the information they need? Perfect. If you have any questions, please let us know. We want to make sure we're communicating with everybody. Okay, so here is the, make sure, yeah, that's right. The board request expanded, so we did exchange a few emails. So we discussed this during the November meeting, and so it was on recording. We sent this to Trustee Dawson to say, here's what the SHAC talked about of this request. We have the following questions, and she responded. So you can kind of read that. I do believe I forwarded this to everybody. If not, I can send you a copy of it. But long story short, you can see at the very bottom, she is requesting if we can do surveys or something to understand how many minutes or hours an average day that our students spend on a screen in any capacity. So a work group is looking to be formed on this, so we're going to talk about this in the next steps. We don't have to chat about this right now. Let's talk about it as part of that work group, but this is the continuation of that. Okay. Okay, so now we're going to go through the subcommittee updates. So we'll just go through these one by one. If the subcommittees had any action items, those are going to be presented within those slides. Okay. This is Kristen here. Here we go. All right, bylaws subcommittee updates.
Hi, I'm Kristen Brown. I am the committee chair for the subcommittee. We did not have a meeting since our last group, but since I knew quorum was coming up again, I looked at some numbers. I don't know if you want to share this now or if there's a whole special topic to bring that up later.
Share away.
So there has been concern in previous meetings of meeting quorum, not meeting quorum, the struggle with that. And should we change our quorum rules and what might that mean for us going forward? So I looked at our attendance data for last year's SHAC, which was 56 members. We had 4 meetings with that group, that cohort, and only the first of those 2 meetings met quorum, which meant that the final 2 meetings, if we needed to approve something, we technically couldn't, and that's where that challenge comes from. While I looked at the attendance over those 4 meetings, there were 7 members who were on the roster who attended no meetings. There were 8 more members who only attended the first meeting or the second meeting. So my recommendation is maybe not to change the quorum rules, but to be paying more attention to the attendance of members. And if somebody hasn't been here, 3 in a row, it is in the bylaws that the membership subcommittee can suggest removal of members. So my recommendation is to focus more on that avenue, unless that's
Okay.
more onerous.
So focus on removal, yeah. So I will say in the past, this SHAC has gotten into, I don't want to say trouble. I'd say they got into some activity where they were removing members, and there was debate on if only the board can remove members versus since they appoint them, they remove them. Now the SHAC can certainly go to the board and request that, hey, we have these members, we need help meeting quorum, we'd like to remove these members. So that's obviously a thing, but we have to wait for their timeline during a public meeting. And so could we go down this route? I do think the board would probably support that we manage our own membership. However, I would say from a transparency perspective that the SHAC doesn't remove its own members just because we were appointed by the board itself. So we could certainly do that. I just think the timeline of removing members takes time.
Yeah.
Go ahead. Does anybody have comments on quorum requirements and so on? Yeah.
Okay. So I've been on the SHAC for more than a few years, including this last SHAC. And I have seen a change where I think in the beginning it was, and I don't remember the exact numbers, there were probably less members, not 56. So it's probably easier to meet quorums per se. I didn't even think about quorum because most of the people came. Now, here or there, you might miss a meeting or whatnot, and that's going to happen. But for the majority, like, they were there. And so, although we don't want to limit, parents from volunteering, I do think that attendance, if you're on this committee or whatever committee, is important. So I would agree that, because I think in the past they talked about changing the quorum, and I agree that we should not do that. The point is that you're supposed to come and be active and a participant. So I guess that would go by either, would it be under the membership or the bylaws or both? Like, how would we go about looking at that?
It would be, if we wanted to make a change in that area, it would have to be both, so that the membership committee would gain responsibility or become more active in that area, but it would still need to be documented
In the bylaws, yeah. So, yeah, I think everybody knows, when the meetings are a year out. Obviously, a family emergency or things happen, that happens and people have to miss the meeting. But, if you have 7 members that didn't go to 4 meetings, I don't understand what their participation is then on the shack.
Just as a thought with regards, and this may have to direct to the membership subcommittee, but definitely the promotion to the public for people to sign up for being on shack probably needs to have a stronger emphasis on, there is an expectation that on the basis of this schedule, you have to be able to attend. Otherwise, it hampers what is possible for this committee to be able to accomplish. But I'd also be curious if there's a method of communication, if there's if we're being ghosted on all communications or something of that nature after a certain number of communications. Maybe that can be built in as, this is an inactive member, not to be considered part of quorum requirements or something of that nature. But I would defer that, I guess, to membership to consider those particular avenues, just as a thought.
Yeah, and I'll add, so we started with a very large membership, right? The largest that the shack has ever had is like 71 members. We're now down to 56. After the holidays, I had sent the email that said if anybody would like to step away, it's okay. We actually got a flood of emails over the last week for people who were stepping off the shack. So that definitely helped us tonight to meet quorum. And I do think one of the things that the shack has always done is it has basically accepted all parents that wanted to volunteer. I do think it has been scrutinized more on the district side or the community volunteers, but it's always accepted all the parents, and we did that this past year as well. Like, we accepted 100% of parents. And I think going forward, if we can expect the same amount of interest we had last year, then we're probably going to have more than 70 more than 70 members apply, and that the membership side is going to have to be a little more particular about selecting parent members as well. So I think we're in a good spot right now because we have we have plenty of volunteers, we have plenty of people attending committee meetings. I think this is definitely the most productive shack I've seen and been part of, which is great. And now we're in the new year, and we can actually get super focused since we're organized, and we've started getting the ball rolling on several items, which we'll keep talking about with the updates. So I guess, is there interest to make any changes? Or Kristen, as a committee, requesting to make a change? Or?
No,
Okay.
just informing to open
Okay.
to thoughts.
All right. So I think we're doing good now. Okay.
So I agree. I don't think we should change the quorum, but the way we vote needs to be updated, because we're doing it by show of hands, and that's not the way the bylaws are written.
Well, the bylaws were changed so that it could be a majority vote, because
Yay
it
or
used to.
nay?
Yeah, but it used to be we had to go through every single person, had to be identified, and yes or no.
But you don't think show of hands should be?
Oh, We can certainly do yay or nay if we go through it.
Oh, no, or just by show of hands.
Yes.
But yay or nay, I mean, that's a verbal.
Okay. I am open. We can double check the bylaws on exactly how that's worded. I just know in the years past, it was a huge pain to
Oh,
get
yeah.
through meetings.
No, by show
you
of
know.
hands is great.
Yeah, okay. All
Okay.
right. Anything else on membership or quorum? So just as an update for the membership itself, so that activity really picks up in April, May, June, when all the application requests go out and people start applying, and then the membership committee will start going through those. Okay, is that it, Kristen, for y'all? Perfect, thank you. Okay, so compliance subcommittee. So we have no updates on that.
That's me. That was too loud. We didn't meet. People have been updating the spreadsheet that we have of what topics, and I assume we'll keep doing that. I need to reach out to them a little more, but we're still working on it.
Okay, thank you. All right. Oh, that's part of what we were just talking about with membership.
We have not met yet. However, with all the information tonight, we will meet and decide if we need to make any adjustments to membership criteria going forward.
All right. Any questions on the membership process? I think it's pretty straightforward. Okay, physical activity and fitness subcommittee.
So I am not the chair of that subcommittee. However, the subcommittee does need a chair. Jim was unable to continue in the role of leading the subcommittee. So there haven't been any updates from what you see here at this point. And for anyone that's already part of that subcommittee or anyone that has an interest in it, if you would let me and Ryan know if you have a desire to join in and be a part of it. Does anyone that is a member of that subcommittee have any updates they want to provide from anything that I haven't seen on GroupMe? There haven't been a lot of updates since past meeting, but open up for anybody that has info.
Who all is on that committee that's here? Don't be shy. No? Okay. Okay, so we still have plenty of time in the rest. We have 2 more meetings. There's plenty of action items that we can bring forward. So if there's anything specific for the physical activity subcommittee, there's still time. So don't think that it's dead in the water or anything like that. I guess it just depends on how that subcommittee wants to target, whichever topic. Stephen, is there like any? I'm looking at the list here. I'm not seeing anything that was requested to actually do something like go to the board.
Not for forwarding to the board for approval or anything. There's some questions going out, like with regards to like FitnessGram. There was talk about developing a survey to send out to the PE teachers. I actually don't know. I don't remember off the top of my head if there's been an update on that. And then they've been involved in talking with Wade Haymark, I know, to really have discussions about community outreach programs and things of that nature, trying to really engage with what is already in existence from community partners and things of that nature. Beyond that, I don't know of other aspects at this point.
Looking through the data request, I don't think we had anything from that committee for that. No. Okay. Any volunteers to be chair? If not, maybe you can always send it to us after the meeting. Great opportunity, I'm sure. Okay. All right, we'll move on. Actually, for this, Stephen, if we need to, by the way, we can arrange a meeting for that committee just to kind of get conversation started again. That's probably a good idea that we just go ahead and we'll schedule a meeting with the existing members and we can talk about who can chair that after that, okay? Otherwise, it's probably going to be Stephen. Here we go. All right, Mental Health and Suicide Prevention Subcommittee. I can't remember who was the chair.
Okay, so Kristen and I are co-chairing this together, but so we had a few meetings in December. And so one of the things we did, or that we were able to finish, was we got questions together for surveys to be given to the counselors, teachers, as well as students. And we sent it to the admin. So then one of the questions we had, or discussion points, was we feel we're kind of at a standstill because I know the district is doing the survey with Dr. Vinson, right? And then, I mean, I know getting so many surveys can be difficult. I think there's a clear gap, in services, and we're trying to find that gap or look at, how the community feels about it, to then come up with a recommendation, right, as to maybe steps going forward. So I just wanted clarification on that, like, where are we on that process? And then, Kristen, you want to talk about the other things we're doing?
Well, we're, okay. As far as the substance abuse, we're still looking at that and going over the data collection. And then our members, two of our members, are doing a little bit deeper dive into the suicide and outcry policies. And do you have a comment?
Okay. Did you want to do it, Chrissy? Okay, sorry. In looking into the CISD outcry policies, we did comparison with the TEA toolkit to our Conroe ISD suicide outcry policies. And then we also did a comparison into, what was the other one we did? Oh, the AFSP model policy. I think part of the problem is that we're not sure what exactly they're using in the schools, and I do believe that each school probably has a different way they go about it. So because we don't know exactly how each school is, what they're using, it's difficult for us to find the gaps. The toolkit, when we looked at that toolkit, it's extremely comprehensive. It's fabulous. I feel like it touches on every single thing that the schools need to be doing, but we don't know if that's what the schools are currently using.
You're saying
So,
the Conroe ISD toolkit has
Yes.
a comprehensive?
Yes.
Okay. The
That's
TEA
it.
toolkit?
Yeah,
Okay.
that's the,
Okay. Okay.
We're not sure if the TEA toolkit is being utilized by the CISD.
Okay. Is anybody from the district have comment on that? Yeah.
Can you hear me? Okay. So I could talk a little bit about the suicide outcry protocol. So our protocol is listed on our website. If you just search in Google Conroe ISD and then just put crisis or suicide protocol, it's listed on there. We have a very, it lays it out step by step. It's available to parents, and then this is something that we train our counselors in as well. So the counselors are very well versed in this protocol. It has even the documents that we use. We make sure at the end, we secure the student. We make sure that, if there is a possible outcry, that student is never left by themselves. Then we complete a student conference form. We notify the parent and guardian. And one thing that we really value in Conroe and in this district is that we, no matter what, is that we're going to send the student home, because we never want to assume that they're joking. We want to make sure that, that the parents are given the resources. We give them national community resources that they can use. And then if needed, we're also able to have a re-entry meeting where we kind of discuss goals, what we can do to ensure that the student is safe for other to make sure that they're safe. And then I can also send this to you guys as well. So you guys, oh,
We
you-
actually
okay.
have it, and we did review it in depth. The concern is actually more that there's not anything on the Conroe ISD website about postvention after a suicide occurs, as well as prevention and the methods that Conroe ISD is using that are consistent with the TEA toolkit. So while the suicide outcry protocol is very clear, that is for an outcry event, but there's not significant information, prevention, and postvention. And so we're just wondering where those gaps are.
Okay.
As a teacher, we have to go through steps that are at the training of every, beginning of every school year. It does, oh, so as a teacher, we have to go through training at the beginning of every year. And part of that is suicide prevention. And so listening for certain things, being able to identify certain behaviors and things like that. And we have to pass a quiz on that. So every teacher has to go through that every single year at the beginning before we begin. It's actually due in October, but usually most of us complete it in the summer. Just as a reminder to what to look for so that we can be preventative. If we see a student that is exhibiting certain behaviors, we can go talk to the counselor and say, hey, this is what we're seeing. Would you please meet with this child? So.
Okay, I do have a question that you might be able to help me with, though. In going through all of this, especially the toolkit, I did see that there is supposed to be a specific person at each school that is the, I don't know what you would call it. What do you say, Christina?
Listed as designated suicide prevention coordinator.
Is that something that you know that you have at your school? Like, would you know exactly who to go to?
I would go to our lead counselor. We have so many people in charge of so many different things. Honestly, I don't know who wears what hat, and then it changes year to year. So I'm gonna send that child to their counselor because they know that counselor, and then that counselor can take them to that designated individual, because that child may not open up to a different person without an introduction. If I send them to a random person that they're not familiar with, you're not going to get any results. So I'm going to send them to the counselor that they know, and then that counselor will take them to the next step. Does that make sense?
Yes, but I'll be very honest with you. Sorry, my daughter took her life it's been a little over a year. I love everything about the high school that she went to. It's amazing, but I don't know if they have, I don't know how to say this. We did not have that experience. We did not have a counselor that she was able to go and talk to because they're extremely busy. They have a million things, especially academic things.
Our counselors will stop everything that they are doing. And I guarantee you on my campus, 100%, because our lead counselor is passionate about this topic. They will stop what they're doing. They'll stay there till 3 in the morning, whatever it takes. They will make sure that that child is taken care of. Our lead counselor is incredibly passionate about this. And I've had a child that has attempted. So I'm somewhat.
Yeah, I think that at this point, really just for us as a subcommittee, I think that our biggest issue is that we are not, like, I love all this information you're giving us. It helps us. But we don't really know who to go to if we have those kind of questions within our subcommittee.
Gotcha.
And then I also want to acknowledge, I appreciate that at your campus it's like that, but we do want to make sure that we're acknowledging all the campuses, elementary, middle, intermediate, and high school, and that all the campuses throughout the county and throughout the district have the same resources so that there's not one wealth of resources at one campus and not at another.
Yeah, and I'm going to ditto that simply because the high school that one of my students went to, one of my own personal children, we had a very negative experience, and he had an attempt, and the campus handled it incredibly poorly, like to the point that we could have brought lawsuit. like it was that bad. And of course, I'm not litigious and I'm not going to do that, but the campus needed to handle it much differently.
So I'll try and be brief about this, but I'm curious, is there a standard for each campus to go through something of a mock, or in healthcare there's scenarios called megacodes. Simulation deals where you create potentially a worst case scenario. Everyone has the experience of going through it, but it's simulated and make sure that all the steps are done, and it brings in multidisciplinary team of who's supposed to respond for everything. And so I'm wondering, first, I don't know if such a thing exists for an undertaking like this, but for each campus, is there a record of the multidisciplinary team that would be, the primary teacher, or in the high school? I mean, my son's at College Park, and he doesn't necessarily have a primary teacher, but that series of teachers that he has the daily exposure to, in addition to APs, principals, counselors, the whole gamut, the people that would be involved in this response. Is there such a thing of, first of all, ever doing a mock scenario like this, but also track the kind of response?
So we have a district crisis team, and so on each campus, the school counselor is like the main person that responds to a crisis. So that's when we would follow the suicide protocol. But if there's something that's really, really big, and that campus needs support, then there is a whole team of counselors. We also have 2 district crisis intervention specialists that then become, I would say, mobilized, and we're able to go to that campus to provide support to the staff and to the students as well. Help with anything that they need there. And then it's really it's very case by case basis. We want to be very careful. We want to follow what the family is wanting as well. Whenever we support those families when we have cases of crisis like that. And then also, in addition to that, we also, every single counselor has a comprehensive school counseling plan where they lay out, their whole plan for the year, where they address things like suicide prevention, human trafficking, substance abuse, things like that. And so they detail their plan out for everything and make sure that, that we are meeting those requirements as well. But for the district, we have a crisis team that can be mobilized whenever a campus is in need.
Do they ever do simulation elements to evaluate their process of intervention, to identify if there's gaps in either the engagement by a particular individual, or taking, case scenarios that are documented of how something progressed and things like that, to be able to identify the potentials of shortcomings? Or, I am aware that there's a lot of research in healthcare on the medical side for doing simulation of mock codes, these mega code events, for not necessarily the purpose that you can apply it, and it's going to be exactly like that every time someone has a cardiac arrest, but it gets you very well versed, very well understood in the role that each person serves within that particular situation. So that it's not, I think I need to call this person, or you have that one campus that's the extraordinarily capable counselor, but perhaps the next campus over, they've never gone through something like that. They're not nearly as capable. But essentially, is there that kind of a setup with it?
So we have meetings. The district crisis team has meetings, and they go through stuff. And I haven't personally. This is my first year in this position, so I haven't participated in. I went to the first meeting where they did a big training on everything, kind of protocols, checklists, things like that. From my understanding is that they do go over scenarios and things like that. But I could double check and make sure to see if they actually do simulations, just because I haven't been a part of that. But I know during our regular counseling meetings, we meet often. And we do go through certain scenarios just because, counseling, just like with a lot of things, it's not black and white, it's very gray. So every situation is different. So we kind of work through different scenarios just to help our counselors be as prepared as possible.
And I just want to clarify for Stephen, you mean at each campus, are they doing mock scenarios, correct?
Correct. And anyone can jump in and correct me if I'm speaking out of my assumption on things, but each campus has its own unique leadership structure and exposure, as well as defined set of resources available to it. My experience in Conroe ISD is that there is so wide a variety of uniqueness from campus to campus that implementing one very small change for an entire district is that's a mammoth change for some places, and it's nothing at others.
Was there anything in particular with the TEA toolkit that, I guess, so I'm thinking about where we go from here, right? So surveys are one piece, which we're going to kick this off again with the district to try and understand their timeline, and if we can incorporate the some of our questions with their survey. I think, Taylor, they asked us to work with you on that for those surveys. I don't know if anyone from the district can give us information on when Dr. Vincent's surveys will be going out. Okay. They're not finalized yet, yeah. Okay. Taylor, did you have a comment? No? Okay. Anyways, I just wanted to make sure that if that we're going to keep pushing this, as in we want to get the questions that the subcommittee put together, which there was a whole lot of them, right? To try and incorporate as much as we can into it without overloading it. And so just, well, I'm going to get back to y'all raising your hands. Do y'all have questions that are going to be incorporated around mental health? Taylor, okay. Yeah. So for these surveys that are going out, it's my understanding that it's going to be there's going to be various surveys, right? It's going to have teachers, parents, students, but we don't have a timeline on any of these. So I guess the question is, how is mental health going to be incorporated into those surveys?
With the ones that the district is sending out?
Yes.
That I am not sure.
Okay, that's what we're trying to understand.
Okay.
So we can take the subcommittee's questions that they've made and incorporate them into that, or we would end up sending our own survey, which would just be survey overload for most people, which 2 surveys is, I don't know if that's too many, but I guess that's what we're trying to figure out. Because if we go to the board and say, hey, we want to send, this survey for this, and a survey on e-bikes, and a survey on whatnot, people are going to stop answering those surveys.
Yeah,
right?
absolutely. I could definitely ask. And then I also wanted to add, I know I've been going to the subcommittee meetings, but I haven't particularly, I know you guys are working on something separate from those meetings with the TEA suicide prevention toolkit. So I could definitely sit down with you guys at a separate time and kind of go through and kind of look at the difference to see if there's any gaps, and I could work with you guys on that.
But Kristen, before we get that, Casey, you had a question. Sorry.
Never talked on this. I'm wondering too if maybe we just need data of what the numbers actually look like, of how many of these risk assessments are counselors doing, what's the outcome of them, what happens next, what does that look like? I think the data is going to be a little bit skewed depending on what identifying the students, what that process on that campus looks like. Obviously, numbers might look higher if that campus has a really good way of identifying students that are struggling. But I wonder if we even know kind of like what we're looking at, what happens from a data standpoint. In a previous district that I worked at, counselors would update their numbers every month to say, here's how many risk assessments I did. And that gave kind of our district team an opportunity to look at those. If we're comparing like a junior high to a junior high, well, this junior high had 10 risk assessments and this had 100. Is it really that these kids are really struggling more at this campus, or is it an issue with identifying the students and then what's on the back end of that too?
Or documentation.
Yes.
We know some people don't like to document a lot.
Correct.
Yeah, probably, Kristen.
I just wanted to clarify one thing. So one of the questions that we need answered is, and it's good to know that the CISD employs counselors and that there's policies in place. What we're trying to find out are, do students have timely access to mental health care? Do they have timely access to mental health care? That's really what we're trying to get to. In the responses from CISD, we, the policy and the counselors usually handle that, but we're still not getting the answers that we're looking for. We need to know, are they getting timely access to mental health care? I just wanted to clarify that because we know that you have counselors in place. We know that there's suicide prevention in place. We're going to check those and with the TEA regulations or the ones that they're using. But are they actually getting the help that they need? That's what we're trying to measure. And timely access.
What does the district collect from a data perspective since the group that y'all have meets? I mean, do y'all review that data?
Again, I'd have to ask because I've only been to one of their meetings, but I know like whenever I was on a campus before this, we have a system where we would input whenever we would do a crisis protocol into the system. So we do have access to that data. How many suicide protocols have been initiated.
Would we be able to get, Chris, would we be able to get that kind of data? Is that, as long as it doesn't have student information?
We did.
Okay, so we can try and dig that out if we have it in last year's shack.
I think what we're trying to get to is that, there's toolkits, there's counselors, there's all these things, right, that are there to help the students and families. But then we have had outcries, and then we've had actual students that, actually committed suicide. So it's like, one is one too many, obviously. So it's like, well, what's missing? That's what we're trying to see. If there is a gap, we feel that the gap is there, but it's perception, right? Because we've had some bad outcomes. But, that's where if we get feedback, from the surveys, and then they may also have good suggestions, of like, this is what I think is missing or whatnot, from admin, from teachers, from students. But I guess I know that the survey from the district is important too, but I don't know if we should we have it ready, so I don't know if it's possible to send it out, because I know that this is a topic that people care about. This is like one of the largest committees, so it's because people are, they want to make sure their child's mental health is good, and I do think that, if there's a way for us to collect this data or look at the surveys and just see what we get, then I don't know if there's a way we can get it out, because I think we're waiting for this district survey, and obviously we're not in charge of that or have no control over that. So
Yeah,
is there a point of waiting?
I think we had assumed that the surveys would go out sooner than later, and it seems like it probably later in the year, which I don't remember when was the OHI normally done? December, January. Okay, so it would have already been done by now, yeah. But it sounds like these are going to be till the end of the year. Yeah. Okay. So we're not doing OHI anymore, right? The district's not doing OHI. So I assume I don't know if we
Sorry,
should.
can you say what OHI is?
Oh, it's the Organizational Health Index. It's for the last 30 plus years, Conroe ISD has used the OHI. So it's basically a survey, like a job satisfaction / other question survey that teachers and administrators take to kind of get the pulse of the district, and that is used for campus improvement plans. It's used for all kinds of stuff. So the district, with Dr. Vinson's appointment, that's changed. So the OHI is no longer going to be used, and it's going to be, I guess, a set of different surveys. And I think he's bringing these with him from his previous district, and I guess we'll see how. I guess nobody knows how it's going to be yet. That's why we're trying to ask these questions of when we're going to get these surveys. Go ahead, Ron.
I was just going to say that, he's also getting his bearings,
Yes.
figuring it out. Like, obviously, he's new to the job. It's a lot, and it's a big district. So I think as an administrator, he's probably, I mean, I can't speak for him, obviously, but he's probably looking at like teacher retention or satisfaction,
You
all
wouldn't have
that
mental
stuff
health,
that
yeah.
like is not related to what we're doing.
Yeah, I agree.
So I think from my perspective, and I think from the committee's perspective, we all are like kind of at a standstill at this point because our tasks in progress have kind of been worked on or done.
Okay.
So we're waiting. So I think if there's a way to send this out or at least discuss it, do we need board approval for
So
that?
what we could do is we could vote on sending the survey, because y'all finished the survey, right? To the board for approval to send out, and how that would get sent out, I guess that the district could send it out via parent access center, parent channels, or it could be something that, it could be multifaceted where we send it out via social media. The SHAC is looking for mental health information. Would you please fill this out? And so, yeah, I would support that. I think we certainly could. I think we had just originally assumed the surveys would go out and we could incorporate as many questions as possible. If that's not going to happen, I think you're right. We do need to get it as a SHAC survey, which it would be great if we could include all the survey items, especially since we included the first data request, which, by the way, we can do more data requests, right? I mean, I hate to put more work on Dr. Taylor, but yeah, she got it turned around within like 10 days, so that's her fault for being so efficient. I'm gonna
Oh no, I've worked with Dr. Taylor.
She's great. Yeah.
She's great.
Yeah.
So, because I remember when we were doing surveys every week. We were sending it to the whole school when we did the cell phone stuff.
Right.
So, and they were looking at that day and then deciding and PowerPoints and whatever. So I think this is just a starting point, and I think we just want to get the ball rolling. So if there is a way to, because we've reviewed the questions and kind of thought about them. If they want to make tweaks, great. Like let's talk about it. Let's get it started.
Okay, I support that. I mean, we can vote on that. It's part of our agenda to take action items on these. So we have the survey, and so the action item someone would need a motion that we take the mental health and suicide prevention subcommittee's developed survey to the board for approval for sending to whom? I don't remember. Is it meant for everybody? So staff, parents.
So we have
students?
separate ones for, the students and then counselors and teachers.
Okay.
So we have a couple different.
So we could put that all in one form, and they pick what their role is, and then based on that, it could have the breakdown of different questions. So
It is different questions, yeah.
Okay.
Some of them are some different questions,
Okay.
but similar,
Okay. I'm just trying to make sure if we do it in one big survey, and then when they click what their role is, it gives them a specific set. So we don't have to send out multiple surveys, right? It's just one survey.
Well, I don't know if they send it out, like, could you send it out to students and then send it out to, like,
I don't know how that would
staff
work
/
with
admin
students.
and counselors, like how, when
I
you
don't-
send it out, like.
I think we'd have to figure out for students. I think for parents and the staff, it's a little more clear, but for students, it's different.
Okay,
Yeah.
yeah, and parents too,
I would
yeah.
have to ask. I'm not sure.
We'd have to ask, yeah.
Yeah, I wouldn't know.
'Cause I think they just send it out globally,
Yeah, go ahead.
right?
So I think as far as surveys, and correct me if I'm wrong, but Senate Bill, I think 12, there was discussion in that bill about specifically speaking to surveys and students. So I don't know specifically, but I remember
Okay.
that was an issue. So that might be a sticky point.
Well, we can at least go to the board with the request for the survey and I guess try and figure out to whom we can send it to. Y'all had survey questions specific for students? Yeah? Okay.
I just had a question, and I may have missed it somewhere too. Before I voted on sending it to the board, I was wondering, I totally trust the work of the subcommittee, but I'm wondering what questions are in the surveys before we would vote on sending it to the board.
Okay. Yeah, I guess what we could do. Yeah, that's true. So if the full SHAC is going to vote on the survey itself, they would probably want to read it. So I'm trying to think.
Do you have it as a shareable Google Doc or something of that nature? Because if you do, we can share it on GroupMe and everyone here can be able to access it on the spot right now and look through it.
I mean, I don't know if that could be homework versus, because I think
Well, you'll send a
that could
copy
be
of it.
one action item of like sending it out so that everybody can look at it and see. And then, I mean, I hate to wait, but we've been waiting. So I think that I do agree that they should look at it before
We still have
they.
2 more meetings right before the end of the year, the school year, so we still have time. I do think it's a good idea, but if we throw up all the questions on the screen here, we're going to be here till 10 p.m. 'Cause
Yeah, no, I
everybody's
think
going to
that-
debate every question, right?
I think it has to be homework.
Okay, well, let's do this then. So we will send out a copy of these surveys to the group, the full shack. And I think what we can go ahead and do is contact the board about when we can send these surveys, and then we would approve it. I'd assume, I guess as a shack too, as the members of the district, could also help us fine tune that with the with district admin. And that way, once I guess if the shack is on board with those questions and district administration is on board, and then we would get board approval to send it to whichever groups we can send it to, then that seems, we could definitely do that by March, right? I mean, that doesn't seem too difficult. Okay. Yes.
I just have a couple of thoughts. First, I just want to say I'm so sorry for your loss. What I'm hearing is we're not sure who the designated suicide prevention person is in buildings. Is that what I'm hearing you say, that people are unsure of that? And maybe that's a question to include, is why I'm putting that out there. And this is just a thought. I have no answers or solutions. But counselors are overwhelmed. Someone over here said that. Teachers are overwhelmed. When this profession, we're overwhelmed. Are these counselors being asked to be academic advisors and suicide prevention advisors? It's a huge question, and I don't have the answer for it, but I would hope the answer would be no.
Well, that's what we've been discussing in all our meetings.
Right.
And so our goal was to get have data to say there's a gap that you're mentioning, right? And Cassandra has brought that up as well as an issue. So I think that's why we're kind of trying to push that so that we can objectively go and say, well, I don't know, I'm just making up a number, but 80% of parents feel X. So then before we say, should we do something more, we can objectively say that it's a problem.
I think there's some very telling facts here that we need to review. One is that the counselors are overwhelmed. The numbers were, again, one counselor per 800 students at the elementary school, anywhere from 1 to 600 to 650 at some of the other schools. And then when you take in consideration the amount of time that they're actually spending is 80 or 90% of it is academic. It's not mental health, and they're not mental health professionals. So this is a system failure, in my opinion. It is a system failure because you do not have people that are trained on site that have time and that are mentally health trained to assist children who are distressed. The children see this, they feel it, and they do not feel like they have access to mental health care. And that's what we're trying to establish. We are hearing things we're on the ground floor here. We're hearing these things. The answers we're receiving are, there are people in place, there are counselors. The counselors do not have time. So it's not really working, unfortunately. Now, the solution is to try to find a system that does work. And that's what in order to do that, we have to get the numbers together, find out exactly where the gaps are, and figure out a way there are ways to do this. You can partner with outside resources, you can make resources more available. I think just in my humble opinion, I think this should be taken off counselors. I think that we need people in the school that are trained with mental health to address people who are in need. But that's just my thought.
If we were to request existing data, what type of data would we be able to at least ask for? Like, what data is there? Is it the number of outcries? Is it, like, can we get a sample of information that the district might have on this? Or maybe that's the question.
I have a list of information, and I think what would be best suited, so if for no other reason, so we can move on to the other committees, but next meeting, we can, since we're going to be submitting the surveys, I could also compile a list and be prepared to have that for you on the information that we would like to request.
Yeah, I'm saying we can, if you have a list of the data items that the subcommittee needs, we can submit those as soon as possible. That way we have them ready.
I do.
Yeah. Okay.
I'm gonna look. I have
Okay.
it written down. I'm gonna have to find it. But I've compiled a list of the information that we need because whenever there's referrals made, this should be documented somewhere. And so we're trying to see what's happening in the school. That would be some data that would really be helpful. What's actually happening, and how many people are actually being serviced, and what was their experience. That's the information we need. But I have more concrete titles and things for that information, which I can submit to the chairs if you would like.
Okay. Casey?
Yeah, I think depending on the campus's procedures for like how the students are accessing the counselors, that potentially would be pretty easy to get as far as like how many kids we're seeing, how long approximately the meeting was, and then what happened, like what was the topic. I don't know if any of the high schools use like the electronic like check-in, I'm here or whatever for their counselors.
I think everything with like students coming to see the counselor, it's all campus-based. We don't have especially like with elementary, that could be very, it kind of varies. But then also to answer your question, with the person in charge of like suicide prevention and mental health, that is the school counselor. That is like the head person for that. And, just like you guys were saying, it is a lot of hats that counselors are wearing. And we have such amazing counselors. They are so good. They really care about their communities, their students, but it is a lot on them. And, and their caseloads are high, especially at the elementary level. So
Is it safe to assume that the counselors are by default the designated person, or can it be somebody else?
from my understanding, they are.
Okay.
Yep. Especially for suicide prevention, because they're the ones that do the suicide outcries. Now, we do train our APs and our principals in the protocol, because there are times where, especially like, just speaking from personal experience, I was at an elementary campus last year, and I was the only person. I was the only counselor there. So if I was sick or if I was gone, and there was an outcry, that the APs would handle it. So we do have other people that, if the counselor's not there, it would be the AP or the principal. But all in all, it would be the school counselor that is the main person for that.
Okay.
I just want to say that I would be willing to vote without seeing the questions. I've listened to this committee. I can't imagine that you haven't done a fantastic, thorough job. So, I'm just putting that out there, but because to wait another month, it's January. My husband's attending, a funeral service on Friday for a student. I make a motion that we vote without seeing the questions.
Okay. I have a motion. So the motion is to approve the subcommittee surveys as is. Now, they did send those to us, and we did look over them. I think they're very good. And, yeah. Did I have a second? I'm sorry. There you go. Grab. We can amend that in the motion. Yeah, so the y'all had surveys for, but by the way, this still has to get board approval. It still has to be, legal for us to send those surveys to. Okay, so I have a motion, and who was the second? Yeah, did you grab hers? Debbie, yeah. Well, I think what we're gonna do, we're approving we're voting on the surveys themselves, but we're still going to have to go to the district and the board to work on getting approval to send these. Basically, we'd be voting on the questions themselves for the questions in the surveys themselves. So if we do, so we'll take a vote here in a moment. If there's not support for that, then we can still share all the questions with everybody, and we'll have to wait till March to approve those. Now, by March, we would have everything else in order. I would hope that, whether we'll have an answer that we can send them. It just means that the sending of the survey would be delayed until after March, which I don't know what the date is. March, so like 20, was it? No, it's earlier than that. The 3rd? March 3rd. No, we have to vote in a public meeting, yeah. Okay, so I have a motion, I have a second. I guess everyone, so I actually was looking at the bylaws, and I'm reading through them here, and I thought we had changed this last year where we could do it by show of uplifted hands. But here it's saying yay or nay. So I think what we'll do first is we'll, in my opinion, if you raise your hand and we have a list of everybody that's in here that approves it, that is a yay. And then for those who do not, we will collect those. And it's much easier to get no's and abstentions than it is for yeses usually. Okay, just to make sure we have that. So do I have support for this motion to approve these survey questions, which again, it's still going to have to go to the district and the board to approve and get through. Basically what we're asking is just the survey questions themselves. We have a second. If you support it, please show by signs of uplifted hand. Okay, if you have abstention or any abstentions, I guess we'll start with that one. Any who, okay, so yeah, Dr. Kopeski and Kelly. Is it Kelly or Kel? Kelly, okay. 2 abstentions. And those not in favor? Show of uplifted hands? No? Okay. Thank you. So the motion passes. Okay, so what that means is you already sent us those questions. I think you sent those to Stephen and me. So we'll start engaging the district with that, and we are going to send a copy to everybody. Yes, okay. And if anyone has any input on those questions, I guarantee you the district is going to come back and they're going to say, no, you can't ask that question, or we recommend you say this. And then of course the board is going to see those questions. I'm sure at least some of them will read it. So we'll communicate on all that. Okay. Any other questions on? Are there any other updates from the mental health and suicide prevention? Perfect. Okay. Thank you all so much. Okay. Student physical safety subcommittee update. Tricia.
Thank you. So we had a small group meet in December. We are interested in getting more information on the use of the electric micromobility devices, or EMDs, in the district and in our area, in our community. We previously received information and incident data from Montgomery County Hospital District. We also got some information from CISD Police. To summarize the CISD Police information, it was limited. They don't really capture a lot of information about these incidents on their campuses. So it was basically, we don't have a lot of information on it, but it was helpful to know that that's the state of the information. We worked together as a group to draft some interview questions for CISD stakeholders about the use of these devices. We're sensitive to the fact that there are really important surveys, like the one we just discussed about mental health, and the ones coming out of the district from the new superintendent. And so based on my own work as a researcher and as an educator, my inclination was for us to do some really limited interviews. This would be to folks who are from all feeder zones, and the idea of the people that we want to talk to, people who would be especially helpful in giving us information. So this would be school leaders, administrators, PTOs, crossing guards. There's a couple who have a lot to say about this, and also selected parents and school faculty, and it might be people among the SHAC. So the thing that our subcommittee is most interested in is getting input from the SHAC about who those people ought to be. And I want to get guidance from our co-chairs about the appropriate way to solicit that information from this group. But the thing that I was hoping we might act upon today was getting permission. We came up with a set of questions, which I'm going to show you on the next slide. And so a motion from the SHAC to submit those questions to the board for approval so that we might be able to do these interviews. To give you a sense, here's what the interviews would be. These are literally the interview protocol questions that we would use. So identifying information about to whom we were speaking, and then asking them about their commute to school, how they get there, and when they commute, what kinds of interactions do they have with kids on personal vehicles? Like, do you sit, when I take my child to Colston Tough, if she doesn't take the bus, I have to go down Branch Crossing, and I get to the stop sign, and I have to turn right on Cranebrook, and I interact with at least 4 crossing guards, and there's kids on bikes and scooters and all kinds of things all over the place. So we want to ask about the school's commute and what the school's commute looks like, how far kids typically have to ride or walk, and what major roads or arteries students have to cross, and whether there are crossing guards. Another question is, what challenges do you see with your school's commute? These could be high-speed roadway crossings or challenging traffic patterns or patterns of usage that you already see. Examples of these would be, I often see on the Parents of Conroe ISD Facebook group, folks talking about how challenging it is for kids who go to Lamar Elementary to cross Woodlands Parkway, the traffic patterns in front of McCullough at Glenlock and Panther Creek, or folks who are lining up on Panther Creek Drive to go into the car line at Sally K. Ride. Understanding where the challenging patterns can be really, really helpful for us to understand what families and what staff and community members are seeing at each school. Then we'd want to move into these specific questions about these electric micromobility devices. Have you noticed a change in bike and scooter use over the last couple of years, and what have you noticed? And then asking about what folks think could be helpful as a mechanism for addressing challenges they see. What policies are currently in place that you know of about who's allowed to ride or walk to school, whether there are restrictions about parking or dismissal. And then asking about what additional policies they think would be helpful for kids riding and walking to school. And then realistically, what do you think the school, the district, or community leaders could do to keep kids safe as they ride and walk to school? I'm really interested in these questions being posed in an open-ended way. I think that if you put this in a survey, it would be really easy to be like, do you think that everybody should be required to wear a helmet? It's like, yeah, lots of people are going to say yes, but that might not necessarily be a realistic thing that can be enforced or that might be put out in the world. So what I'm really interested in gaining here is taking the temperature of the community and trying to amass information that could be submitted in an advisory capacity to our school board and to our community leaders. And then finally finishing up with a more open-ended question about other thoughts people might have. The idea would be to limit these to 30-minute interviews. The idea would be to tell the person that we're talking to that we're going to record it. You could do it over Zoom or you could do it in person, either way, and then to code the data from it afterwards to understand what kinds of themes and patterns are emerging. And again, the idea is to really take the temperature of community members and to get a sense of what people are experiencing and what their recommendations might be. My hope would be for us to be able to submit this to the board for them to approve these questions and to approve the ability to conduct these interviews and to be able to get those things underway rapidly so that we could have information for them by the end of this school year.
So this one it's more targeted, right? So the idea is that we would have a call to say, hey, we'd like to hear your input, and then people could sign up for an interview, and it would be like a Zoom interview, or maybe they have an option for a survey if they don't want to do an interview or something like that.
We could do that. I think we also, and it would be a good question. I guess I'm interested in folks' opinions. Like, I think we can get, like, I know that like my school counselor, my school principal would be a great person to talk to. There's like literally these 2 crossing guards who have talked to me a lot in my capacity as on the board of like the Woodlands, the local bike pedestrian nonprofit. So I've got like people I'm already talking to about this who could be super, super helpful. But also after our last meeting, there were a few community members of this body who said, hey, you should totally talk to this person and this other one. So I think start with that group, but also have a mechanism for opening it out to lots of other people too.
Yeah, so for the purpose of the shack, is the goal to take this information and create a recommendation to the board that we need to adopt certain policies related to that?
Yeah, I think so. I think it would be certainly, here's what we're hearing, and based on that, here are some potential policy adoption recommendations we could make.
Okay. All right.
And I had a question, because this looks like a qualitative study.
That's
which
correct.
Means you would need a pretty good size, mean you would need a pretty good sized response of people to get a good temperature of like the people in our independent school district and analyzing qualitative answers. That's pretty time consuming. Who would analyze the data and come back with the answers and recommendations?
Me and the other subcommittee members, but we would do it in a transparent way that anybody on the shack who wanted to have access to the data and help with that could do so.
I just had a question on, you've got questions on there about bikes and scooters. Are we just talking e-bikes and e-scooters, or are we talking all bikes and all scooters?
I think asking it as all bikes and all scooters is interesting, because I think if the only thing we get out of this is a sense that people are saying, boy, the kids really need to wear helmets, is really interesting information, because I don't have a sense of whether that question has been asked. So if in the most limited way, the outcome of this could be that people are like, yeah, we really ought to be, if not requiring helmets, strongly recommending them.
Right, we had a question right here. Go ahead.
What is the plan to solicit the initial request? Like, what is that plan?
The initial request for interviews?
We would have to go, it'd be similar to the survey. We'd have to go to the board and ask permission to have a call out to, either it goes out, again, through the same methods of, I guess through the district or on social media, or through, if it's localized to the schools, like maybe we forward it to the principal and say, hey, can you please communicate this to your crossing guards and PTOs and whatnot. It would be much more targeted than just everybody in the district, right?
Yeah.
At least
I just wanted to make sure we had like some sort of plan to solicit, to set up interviews.
I mean, I'm sure we'd love to hear the students' opinion on.
Yeah, but it's hard, and getting access to them as in an interview is not feasible.
They're going to tell us that they want to ride their e-bikes as fast as they want without helmets, right? So, go ahead. Question.
Hi. Yes. So sorry, we had talked about this with our school principal, PTO, and neighborhood committee. We're at Hines Elementary last year, and maybe last week or so, our principal sent out an email, which I thought was like a district policy, that all electric motorized bikes and scooters are no longer permitted at our school.
Whoa.
So I thought that was a district-wide thing, but I guess it's just our school specifically. So are we trying to look at changing the policy for the entire district, or is it going to be based on the needs of the specific school and where that's so?
That's news to me.
Yeah, I didn't know that. I don't know. I think it's and I don't know if the district actually has the capability to outright ban certain vehicles or not. I think it's to generally get a sense of what people are thinking. And if there's a huge public outcry that people say, yeah, these silly motorcycles, little children ought not to ride them, that could be a pretty straightforward recommendation to make.
Yeah, I guess we need to follow up with Hines and see exactly what that means.
Just met with the PTO. We're in our schools in a neighborhood, so we all met, talked about it, agreed that this is not. I mean, at the elementary school, I can't speak for the other schools that no longer on the 7th, but it came from Conroe ISD, so I just assumed it was based off of this committee, but clearly I was.
Okay, we can always ask. Okay, but we do. So Tricia, are you making a motion? The one that's on the slide there.
Yeah.
So essentially, again, there's a set of survey questions. It's going to be targeted interviews. The idea was that we would take these, get permission from the board to, I guess, interact with the district, to have a call for interviews, and then the subcommittee would help, with the district's help, would help organize those interviews. And remind me, is it a fallback to a survey? So if they want to take a survey, they don't want to do an interview, then, okay. And that's basically those questions
These
we
would
saw
be the
out there.
questions.
Yeah. Okay.
And I would make them more quantitative. I would make the responses more easily analyzed by making them more quantitative, but like making them multiple choice rather than open-ended if it were to be a survey.
Okay. You're using like Likert scales or
Looking
something?
at Likert scales,
Okay.
yeah, for most of them.
Okay. So I have a second for this motion. Selena? Okay. All right. So we're going to vote. I'm trying to think, there was no other items we needed on. Is there any further discussion on this before we vote? Does the district have any input on opinions on the success or? Don't be shy. We need your help. What was that? Okay. Okay. So
I have something, I'm sorry.
Sure, go ahead.
How do we make sure, because there will be some people out there who think that there are no issues and it's wonderful. How do we make sure we're capturing those folks as well as the people who go, I have something to say because I think these things are awful. So how do we make sure, I mean, it may be too big for this. We may just have to send it out and do it how we're doing it. We may not have the data management team to do something like that, but how do we make sure we're not just getting the angry, this is awful, my school commute is terrible, and e-bikes are awful group, sort of?
I think there's going to be some bias in that direction. The people who are more likely to respond are often the ones who are going to have a lot of negative things to say. But I think if we can open it up more broadly into a survey to lots of people, I think that's the way to do it.
I was just going to add that our district is 348 square miles, and
Right.
and the e-scooter issue is really just centralized in a couple of feeders, and it wouldn't be reflective of the entire feeder where you're talking, students live 40 miles from the campus, like it's with no sidewalks. So I don't know how reflective we could get to get broad information on someone's commute. It's really opening that up when you're talking about people's commute when they don't have access to things like that. So it's just a point to realize that it's very diverse.
That's a really helpful point. And I was talking to somebody from the Kenny Creek feeder at our last meeting, who's probably in this room right now, and saying that the ridership of bikers to school in the high school in that community is higher than it might be at the Woodlands High School or College Park. College Park, because I wouldn't ride a bicycle on 242, but also that that some kids have access to cars and some don't. And so understanding what the utilization of personal vehicles is that are not cars, it's going to be different. It's going to be specific to each feeder zone, and getting the nuanced information about each is really important. By making sure that in the survey question, you capture which school you're affiliated with and what attendance zone you're in. Well, it would be recruited. The idea would be that we would recruit people from every single feeder zone to talk to. This wouldn't just be that I'd only talk to Christy Julian. The idea would be that we talk to people from every single attendance zone and understand where the pain points are in the different places. Yeah, no, that was, and sorry if I didn't emphasize that from the beginning. I know. Yeah, I know. And that was why there's a question about are there any or not.
Okay. All right. So I got the motion.
I'm sorry. I'm
Go ahead.
so sorry.
No
I have
problem.
one more question, and I am on this subcommittee.
Yeah.
So just to clarify, so would this be like an initial survey or interview to targeted employees and crossing guards, and not necessarily to the community, the parent communities?
That's the idea.
To gauge to see what the district is seeing, right?
Yeah,
Okay.
that's the idea.
Yeah. Perfect. All right. I have a motion. I have a second. We've concluded discussion. I guess if you are in favor, show by uplifted hand. Tricia, you're not going to vote for your own?
Sorry.
Yeah. Okay. All right. Any abstentions? Any noes? Nays? None recorded. All right. Motion passes. Thank you. All right. So Tricia, as part of that, we'll need to get together on the communication to the board with Dr. Provich, and we'll figure that part out. Okay. All right. Next up, student environmental health. Carrie?
Okay, so I was waiting on the information from the district, which I just received over the weekend. I did not get it on December 20th when it was sent, so I'm glad I got it. But we are going to have another meeting on February 10th at 7:30 p.m. So if anybody would like to join this committee, we do have a small group, but we do need more members, so feel free to join. And we're going to go over the data that goes with the topics above.
Carrie, did you have any, I guess, initial thoughts from what you read initially?
I mean, there's some good information there. I do think that the mold issue, like they just test if someone, I think I'm going to suggest that definitely for the portable classrooms that they're tested regularly, because those are the ones that are out there that are a problem.
Okay. Any questions for Student Environmental Subcommittee? Good. And Carrie, I'm sorry you didn't get that on the 20th. I thought I sent it to everybody. I know sometimes people have multiple email addresses and they're not included in our list, so I made sure to include your other email address on the future communications. Okay. All right, teacher wellness and retention.
Okay, so we have not met since our October meeting. We had discussed all the aspects of the superintendent survey as well as the independent survey that was going out. We're still pending the survey being distributed, and obviously very interested in seeing what can come of it. I put a GroupMe poll from the subcommittee to be able to see if there's an interest or some agenda elements that would be worthwhile to act on before any survey results come in, which I think there's probably some things worth discussing, a few little kind of brainstormer kind of things, but I don't think there's a lot of substance to act on outside of getting some of the survey result kind of elements. So we're in a holding pattern for the moment. I anticipate we'll have a meeting probably in January. We'll definitely have one before the March meeting. So go ahead and put on your calendars March 3rd so that we get another quorum, which would be awesome. And so we'll have a meeting before then, whether there's survey results or not, so that we can have some recommendations to be able to put forward to the best of what we can apply on just our understanding of the environment for teachers right now.
Any other comments, questions? No? So no action items for that? Thanks, Stephen. All right, technology use work group.
All right, so this relates to the email that we got from Trustee Dawson, and it has to do with the technology utilization and timing on, I apologize, the amount of time that's spent by students, and also in regards to how is it implemented with regards to technology use in the classroom. She points out a number of different things that relate to things such as mental health, actual outcomes, and in general asking if we would look into some of the different elements. This got debated a bit and we sent some questions back before, so here we are right now. The idea being that we would form a work group. We would want to have results in half the time of what a regular subcommittee would have. So I have a couple of people on this work group right now, and my intention is to get some pretty quick results, which I don't think are going to be too hard. The proposed goals I have up here, I have outlined, and I've put some initial timelines that may get flexed around a little bit, but the idea being to look at what is the current understanding of the impact of technology use in the classroom. Now, this is outside of the idea of the cell phone rules because individual cell phones are banned in Conroe ISD, so obviously no student has cell phones, right? Nod, yes, absolutely, that's right. So this has to do with every other bit of technology, such as Chromebooks or other devices that are being used in classrooms. So understanding what's the kind of results that we see with regards to that technology use. I've already gotten feedback on a software package that the district uses with regards to dyslexia learning, and a math tutor program that has been incredibly effective for their child to be able to really excel where they had struggled before. So getting a good understanding of some of that research. So that's part one. My hope is to get that done roughly a month from now. Second part proposed goal that I had is to evaluate what's the current status of technology use in Conroe ISD. Now, I had the opportunity to talk just informally with Dr. Pesky and Dr. Winkler, just ad hoc, what's it look like right now, how does it work? Oh, I have a patient sticker on me. Sorry,
Nice.
distracted.
Mhm.
But I'll get more details on it, but really there's, on the Bluebonnet curriculum, there's not a requirement for utilizing technology for instruction. That's a very easy answer so far. And right now the question is, what is the technology use in kindergarten to 6th grade? Was on her initial request. So that's an easy part of answering that question, but diving into are there teachers that are using technology in applying some of their lesson materials? Is that something that's encouraged, discouraged, free for all? You know, how does it stand? What's the district's position on
So,
that right
Stephen,
now?
sorry to interrupt, but so instead of like sending out surveys and asking teachers, essentially this work group would work with the district to understand, how technology is used with the current curriculum and based on the grade level.
I think probably and again, I'm going to be talking to Dr. Pesky, Dr. Winkler through a lot of I think they're probably our best resource right now for being able to understand when you have a curriculum, how is it seen through to implementation? Like you can start with like, we need to learn ABCs and everything. How does it go from that to what are you using to instruct it? And so is there a lot of freedom for being able to say, a teacher's like, I don't want to use Chromebooks. I do essays on blue books and that's it. Versus if a teacher's like, no, I'd like to have, 30 Chromebooks for my 15-person classroom or something like that. What's the extent of the freedom to be able to enact that particular curriculum and deployment? So getting an understanding of that so that it can be presented back to the board. Have I lost anyone? Exactly.
Which with Bluebonnet is much less, right? Because it's more structured. K through 5, right? Yeah. Okay. Do you need to engage Dr. Upshaw as well as part of that, or is?
I will
Okay.
totally engage all.
She'll talk your ear off.
Yeah,
She's
I'm all about that.
supporting. I love Dr. Upshaw.
I want to know everything about it. So.
All right.
So that's part 2 of it. Have I lost anybody? Anyone questions so far? Okay. And last thing is make just a recommendation on technology use based on those 2 things, and really try and have it not necessarily. Our purview is not what's the best way to teach the lesson. Purview of SHAC is what's in the best interest of the child's health. And how does technology factor into the decision to use technology in instruction? So I don't intend to veer outside of that lane of saying I know what's best of how to teach students. I very much do not know that. So much more of it is going to be focused on looking at what does research say about student health when you factor in technology use. And this may also include talking about some kids go home and consume a lot of YouTube, a lot of gaming, things like that. What's that factor into as well of consideration? And address the kind of question of what do we recommend for a student health aspect? So that's the goal at the moment.
Kelly?
Just want to make you aware that as a teacher, we are graded. Part of our T-test is using technology in the classroom.
Seriously?
Seriously, yes, it is.
Is that district grading?
No, that
thing?
is state. That is state.
Go Texas.
Mm-hmm. Now, one of the questions I had for you is define technology, because is my overhead considered technology? Are you specifically talking about Chromebooks? Are you talking about graphing calculators? That needs to be defined a little bit more specifically.
Yep. Right.
Yeah. Yeah.
Right.
To go back to Trustee Dawson's original request, she does appear to want to look at this as part of, you can see in the middle there, screen time linked to children's brain development, reduced ability to concentrate, retain information, reduce critical thinking, emotional intelligence, and anxiety. So like Stephen was saying, less about how to teach and curriculum, more about the health impact of screen time itself. So obviously teachers have been teaching on projectors forever, right? They've had desktop computers in the classroom for decades now. The change over the last, 15 years is really the iPads, the Chromebooks, the smaller devices, right? Good.
And part of the initiative, we can also, if it comes out of really having a very clear answer of, with the research, that that technology use should be limited in instructional elements. I mean, it's not outside the purview of a recommendation to encourage the board to try and lobby TEA to modify its stance of grading technology use as a part of a metric of teacher outcomes. Not that, it all has to do with, I think, trying to approach it with the growing body of interest and understanding of what is the impact of technology, not just on an actual instructional outcome, but are we potentially doing harm in the utilization of technology when you combine these factors together?
Did you have a question?
I just thought I might have a little bit of clarification, just as an example, looking at the use of technology in a classroom, or for example, some teachers really like utilizing it as an incentive. Get your work done so that you can have free time on the screen. Unfortunately, technology, as far as just like the internet, has just evolved faster than I think any other man-made invention. That's just my humble opinion. But unfortunately, we've seen just in informal discussions that it is exposing children. I know a fourth grader who figured out how to get past the little block in the schoolroom, get on a game, I can't remember what it's called, but he went home and asked his mother, "Mom, what's porn?" And that was in school. So that's part of why. That's part of the why. And I know that was a really specific example, but we're not just looking, like Steve was saying, we're not just looking at like the teaching, we're looking at in general, just like how incredibly immersed it is in our lifestyle, and where do we draw the line to really see how we can serve the child best, like you were saying. I hope that helps clarify.
All right. So, Passion.
Just as an aside, it would be better, in my opinion, to consider to have the teachers or the district have a program in place that allows them to visibly screen what children are seeing in real time. I know that sounds crazy, but it's a real thing. Because some curriculums are created with technology components built in, and as Ms. Castleberry just stated, teachers are graded on their ability to efficiently use technology in their classroom. We have a generation of iPad babies, and so it kind of is what it is. The better consideration in respect to what Trustee Dawson is asking is how parents feel about technology use aside from it being used for academic purposes. I think we may be extending ourselves into an arena that could turn murky very quickly.
That's a good point, yeah. Okay, so for this work group, sorry, not to go through this. It is a much more targeted, more short-term, and it's more that this work group is going to be working with the district to collect the research and understand this information so you can see the proposed goals. And of course, the work group itself could use more volunteers. If you can just email us, and we'll add you on there. Stephen, also, you could also, I'm sure Trustee Dawson would have some input on this because she's done a lot of research on it, so she may have some input. Okay, so do we have any more discussion on this? Yes, Chris? So it's basically creating it's not a subcommittee, it's a work group because it's focused on just like some research. We're not going to be, presenting a policy change or anything like that. It's basically like, here's the information that, we were interested in, and that's it. Yes. Yes, because it's an activity of the shack itself. And if there's any recommendations or if there's the research that's collected, essentially we would vote to present it to the board as part of our year-end stuff, right? Year-end activity. Okay. All right. So I guess I need a motion first. I will motion. Can I get a second?
I'll second.
Who was that? Tricia? Okay. So for all those in support, show by the uplifted hand. Okay. All those not in favor or abstentions? None. All right. Motion passes. Thank you. Okay. All right. Do we have anything for future agenda items? We can talk about it now, or you can email us before the next meeting and we can have it added to the agenda. We have several action items we're going to have that we've taken tonight. I do appreciate everyone being here. Any further items? Any other comments? Anything from anyone? Awesome. Thank you all so much for being here. I need a motion to adjourn. Motion. I added to your text. Oh, there you go. Oh, Susanna. Can I get a second on that? Yes. All right. All in favor of adjourning? Aye. Thank you. All right. We adjourn at 6:05 p.m. Thank you, everyone. Yeah, please leave them on the table because we're going to go grab the people that weren't here.